Well, hello, I'm Mark Butler. I'm Labor's Shadow Minister for Health and Ageing, and it's a great pleasure to be invited to say a few remarks to the Consumer Health Forum on the occasion of your release of the latest Consumer Sentiment Survey. This is one of the most important pieces of research we have about one of the most important issues facing Australians in the third year of a global pandemic and leading into a federal election where certainly I hope that health will be an extraordinarily central part of our election debate. In many respects, the survey results come as no surprise because Australians have been telling me and my colleagues it's never been harder to access healthcare than it is today, particularly never been harder to get into a GP than it has been. And when you finally get in, it's never been more expensive. For the first time in the history of Medicare, the average gap fee to see a GP is actually higher than the Medicare rebate for a standard consult, very much driven by 6 years of freeze of the Medicare rebates under this government. We've also heard over recent weeks story after story of people deciding not to get a script filled, or deciding among the many scripts they have to get filled which they'll defer because of the cost of prescription medicines being filled now for non-concessional payments. The survey also sets out the scale of the impact of this extraordinary, terrible pandemic that we've been living through for more than 2 years now. Hopefully, the worst is behind us in this pandemic, but there is still more for us to do. Although we rank very, very highly in terms of 2 doses of the COVID vaccine, Australians embraced it once it finally arrived on our shores, we rank very lowly in terms of booster take-up. 7th in the OECD on 2 doses, but 22nd on the booster uptake. We have to do better than that. And the survey also demonstrates, again, as we've seen in so many other pieces of research, the broader impact that COVID has had on our health. We know there's a backlog in screening. We know elective surgery wait lists have blown out, and we know that the acuity of conditions has increased as people have deferred going to the doctor or seeking other health care because of COVID restrictions. And terribly, because of our experience over recent years with natural disasters, we know, as your survey points out, there will be a very, very long tail of mental health impacts from this extraordinary, terrible pandemic. I really look forward, as Labor's spokesperson for health and ageing, to continuing to work with the CHF on innovative, groundbreaking ideas to deal with these health challenges. The CHF for many years has been an extraordinarily responsible, important part of our health debate, and so it should be. Patients should be at the centre of health policy. Nothing about us without us. Thank you for the chance to talk to you about the forum today and your survey. I really look forward to further engagement.